You went to sleep last night feeling perfectly fine. No warning signs, no discomfort, nothing that would have given you any reason for concern. And yet, while you were lying there in the dark, completely unaware, your brain may have been receiving less oxygen than it needed. Not because of a disease process, not because of anything you ate or forgot to take, but because of the angle your neck was resting at, the direction your body was facing, and the position your spine held for the entire duration of the night. I know that sounds like an unusual claim, and I understand if your first instinct is to push back on it. We have been told our whole lives that sleep is when the body repairs itself, when everything resets, when the hard work of staying alive takes a break. And that is true, but it is only fully true when the conditions are right. When they're not, sleep is not a rest from the strain on your cardiovascular system. For some people, it is where a significant portion of that strain quietly accumulates. My name is Dr. Marcus Reed, and the research I have spent years reviewing in the areas of cardiovascular medicine and neurological health in older adults has pointed me back to this same overlooked variable again and again. Not supplements, not exercise protocols, not dietary interventions, though all of those matter. Sleep position, the mechanical arrangement of your body during the hours your physician never observes and almost never asks about. Here is the piece of information that tends to stop people mid-breath when I share it. The peak risk window for stroke is not during physical exertion. It is not in the middle of the afternoon or during a stressful conversation. It is in the morning hours immediately after waking. Risk is elevated by nearly half during the first several hours of the day compared to other periods, driven by a surge in blood pressure that occurs naturally as the body shifts from sleep to wakefulness. That surge is a normal biological event. What determines whether your cardiovascular system handles it well or handles it dangerously is, in large part, what happened to your body during the hours before it arrived. To understand why position matters as much as it does after 60, you have to understand what changes in the body during those decades. In your 30s and 40s, your blood vessels are elastic. They stretch, they adapt, they compensate for whatever position you happen to fall asleep in, and you wake up with nothing worse than a stiff shoulder. But with age, arterial walls begin to stiffen. The small vessels supplying your brain become less flexible. Your blood pressure regulation system, the one that keeps everything in balance through the night, becomes slower and less precise in its responses. Healthy sleepers experience a natural reduction in blood pressure during sleep, somewhere between 10 and 20%. This is protective. This is the body doing exactly what it is supposed to do. But when a sleep position disrupts circulation, compresses a vessel, restricts an airway, or tilts the body's fluid dynamics in the wrong direction, that natural protective drop gets interrupted. What fills the gap is rarely something your body benefits from. That framework is the foundation for everything that follows. The first mistake is one that sounds so anatomically sensible that most people would never question it. Sleeping completely flat, no elevation, body perfectly horizontal, the spine theoretically aligned with the surface beneath it. Mattress manufacturers have built entire marketing campaigns around this image. Physiotherapy guides recommend it, and for certain complaints, it genuinely helps. But there is a critical dimension that almost none of those recommendations account for. When the body lies completely flat, particularly in older adults, blood does not distribute the way it does in a younger, more elastically compensated system. Cerebrospinal fluid, the liquid that cushions and protects the brain inside the skull, behaves differently without the assistance of gravity. Pressure inside the skull edges incrementally upward. The tiny vessels in the brain, already carrying decades of accumulated wear, spend 7 or 8 consecutive hours under slightly more pressure than they should be sustaining. Research has shown that even a modest incline, as little as 15 degrees of head elevation, produces measurable improvements in intracranial pressure and nighttime blood flow dynamics in older adults. The symptom that most commonly accompanies this problem is one that almost no one connects to their sleep position. A dull, throbbing headache on waking, sometimes behind the eyes, sometimes at the base of the skull. People attribute it to dehydration, to tension, to getting older. They drink a glass of water and move on with their morning. But that headache, appearing consistently at the same hour after the same sleeping position, may be a signal worth paying far more attention to than it typically receives. The second mistake surprises nearly everyone who hears it discussed seriously for the first time. Stomach sleeping. It feels intuitively harmless. You're not compressing your heart. You're not restricting your lungs directly. You're just lying face down. What could possibly go wrong? The answer is your neck. When you sleep on your stomach, breathing with your face straight into the mattress is not possible. So the head rotates to one side, almost always the same side, every single night, because humans are deeply habitual in their sleep behaviors. That means the neck is held in a rotation of up to 90 degrees for 7, 8, sometimes 9 hours at a stretch. Running along the sides of the cervical spine, the bones of the neck, are two arteries called the vertebral arteries. These vessels carry blood directly to the brainstem, to the cerebellum, and to the regions of the brain governing balance, breathing regulation, and coordination. When the neck is held in significant rotation for a prolonged period, these arteries can become kinked in a way that restricts blood flow without stopping it entirely. The analogy is a garden hose with a foot resting on it. The water still moves, but far less of it gets through. Restricted blood flow to the brainstem for 8 hours, repeated every night across years and decades, is not something the body absorbs without consequence. Stomach sleeping creates a second problem simultaneously. The rib cage is pressed against the mattress surface for the entire night. Every breath is taken against resistance. The diaphragm cannot fully descend. The deepest, most oxygen-rich breath the lungs are capable of drawing is never achieved. Across 8 hours, the cumulative oxygen deficit is meaningful. In a 30-year-old body, compensation happens automatically. In a 68-year-old body managing elevated blood pressure or any degree of cardiovascular history, that compression is building a quiet problem in the hours when no one is watching. The third mistake is one people make with entirely good intentions. Stacking multiple pillows under the head to address reflux, sinus drainage, snoring, or breathing difficulty. A modest elevation does genuinely help some of these issues, and the instinct behind the behavior is reasonable. The problem emerges when the stack grows high enough to push the head significantly forward, tilting the chin toward the chest. That forward bend of the neck, known clinically as cervical flexion, compresses the same vertebral arteries discussed a moment ago, but from the opposite direction. And it adds a second vascular concern that rarely receives enough attention in these conversations. The internal jugular vein is the brain's primary drainage pathway. It carries deoxygenated blood back down from the brain toward the heart. When the neck bends forward excessively during sleep, this drainage pathway becomes partially obstructed. Blood returns from the brain less efficiently. Pressure inside the skull builds slowly across the night. The brain's ability to clear its metabolic waste products during those hours becomes compromised. People experience this the following morning as a specific kind of heaviness, a fogginess behind the eyes, the frustrating sensation of waking from 8 full hours of sleep and feeling as though they never really rested at all. That feeling is not laziness or aging. It may be the brain still carrying what it should have cleared hours earlier. The correction is simple. One pillow. One properly contoured pillow, ideally one designed to support the natural curve of the neck rather than force the head into any angle. Patients who have made this single change with nothing else different report that their morning headaches resolved within days. The fourth mistake involves not just position but direction, and it specifically concerns people with any cardiovascular history who sleep on their side. Side sleeping is broadly considered one of the better positions, and for most people it genuinely is. But the direction of that side matters considerably more than almost anyone realizes. The heart sits slightly left of center in the chest and has a natural orientation it functions best within. Lying on the right side causes gravity to pull the heart slightly away from that orientation. More significantly, the body's weight compresses the right side of the torso, and one of the body's largest veins, responsible for returning blood from everything below the waist back up to the heart, runs through exactly that region. When this vein is compressed night after night, the heart must work harder than it should just to draw blood back into its chambers. For a healthy person in their 30s, the compensation is effortless. For someone over 60 managing borderline heart function, mild cardiac insufficiency, or chronically elevated blood pressure, the heart is already operating close to its capacity. Adding consistent nightly resistance to the process of filling its own chambers is a form of cumulative strain that does not announce itself dramatically. It simply adds up. There is an illuminating detail in research on heart failure patients. When monitored in sleep studies, these patients spontaneously avoided sleeping on their right side. Their bodies had registered the discomfort before their conscious minds had articulated the reason. That biological instinct is not arbitrary. The fifth mistake involves a position that feels, on an emotional level, deeply comfortable. Knees drawn up toward the chest, shoulders rounded inward, the whole body curled into itself. Many people, particularly women in their 60s and beyond, describe this as the only position in which they feel truly settled. It feels warm and safe. The physiological reality is less gentle. Three things happen simultaneously in a tightly curled position. The rib cage cannot fully expand, so every breath across the entire night is shallower than the body needs. Blood oxygen saturation decreases incrementally with each restricted breath, and over 8 hours, that reduction accumulates into a meaningful oxygen deficit delivered to already aging brain tissue. The blood vessels running through the bent hip and knee joints, particularly behind the knees, become partially compressed, reducing circulation to the lower limbs. And the neck is flexed, creating the same vertebral artery and jugular drainage concerns discussed earlier, now as part of a full-body compression pattern rather than an isolated one. Addressing this does not require abandoning the position entirely. A long body pillow placed in front, with the knees resting against it at a slightly less acute angle, opens the hips enough to restore meaningful circulation without forcing the body into an unfamiliar arrangement. The sixth mistake is the one that reaches the most people and the one that is most socially normalized: eating a full meal in the evening and having a glass of wine before bed. This describes the standard evening routine of an enormous number of adults over 60, and it creates a cascade of cardiovascular events during the night that most people have experienced without ever identifying their origin. After a substantial meal, the body reroutes significant blood volume to the digestive system. In a younger body with fully elastic vessels, this redistribution is handled smoothly and without notable consequence. In an older body with stiffer arteries and a slower autonomic response, the shift can produce transient drops in blood flow to the brain, brief moments of undersupply that the body scrambles to compensate for without ever fully succeeding. Alcohol compounds this. It relaxes blood vessel walls, causing pressure to fall. The body detects this and responds by constricting vessels to push the pressure back up. Blood pressure oscillates across the night, rising and falling in cycles that stress arterial walls already carrying some degree of age-related stiffness or plaque. Research has documented that even moderate alcohol consumed within a few hours of sleep disrupts the natural protective blood pressure reduction that healthy sleepers experience during the night. Without that reduction, the cardiovascular system works through the night rather than recovering during it. The experience most people associate with this pattern is waking suddenly at 2 or 3 in the morning, heart beating noticeably, sometimes with a light sweat, attributing it to a vivid dream or a need for water, and going back to sleep without investigating further. What that waking may represent is the vascular system attempting to stabilize itself through a pressure fluctuation it was not well positioned to manage. Finishing the last meal at least 3 hours before lying down, stopping alcohol consumption 4 to 5 hours before sleep, and taking a short, unhurried walk after dinner, not exercise but simply movement, allows digestion to progress, blood sugar to normalize, and the cardiovascular system to settle into a more stable baseline before the body becomes horizontal. Of all the positions available, the one most consistently supported by evidence for cardiovascular and neurological health in older adults is sleeping on the left side. Gravity works in alignment with the heart's natural orientation. The large vein responsible for returning blood from the lower body runs along the right side of the spine, and left side, sleeping removes compression from it entirely, allowing blood to return freely and the heart to fill its chambers with less effort. Circulation stabilizes. The heart works measurably less than it does in other positions. But the discovery that most profoundly changed how researchers understand sleep position goes beyond circulation. Within the last decade or so, scientists identified a system within the brain that functions as its overnight waste clearance mechanism. While sleep occurs, cerebrospinal fluid pulses rhythmically through the spaces between brain cells, flushing out the metabolic byproducts that accumulate during waking hours. Among those byproducts are the same proteins found in abnormal quantities in the brains of people with Alzheimer's disease. Research examining this clearance system found that it operates most efficiently during side sleep, and that the left side appears to offer slightly better drainage geometry based on the brain's natural asymmetry and the direction of fluid movement through its structures. This means left side sleeping is not simply a matter of tonight's comfort or tomorrow morning's energy. It is connected to whether the brain is adequately clearing the waste products that, over decades of incomplete removal, accumulate into cognitive decline. For people who find side sleeping uncomfortable due to shoulder pain, joint issues, or long-established back sleeping habits, there is an effective alternative that carries its own significant benefits. Elevating the entire upper body between 15 and 30 degrees, not by stacking pillows under the head, but by raising the whole torso on a gradual incline using a wedge support or an adjustable bed frame. This uses gravity to assist blood return from the lower body, reduces the pressure buildup inside the skull that flat back sleeping creates, and keeps the airway more open throughout the night, improving oxygen delivery across all sleep stages. Adding a small pillow under the knees to maintain the natural curve of the lower back distributes pressure across the body more evenly, reducing the load on any single vessel or joint. The sleep environment itself shapes whether the cardiovascular system recovers or labors through the night. A cooler room temperature encourages the drop in core body temperature that signals the brain to enter deep, restorative sleep and naturally assists the reduction of nighttime blood pressure. Excessive warmth keeps the heart rate elevated and limits access to the deeper sleep stages where the most meaningful physiological repair occurs. Light from screens in the late evening disrupts the hormonal signaling that prepares the brain for deep sleep, shortening the window during which the brain's waste clearance system operates most actively. Sounds that fall short of fully waking a person still produce brief interruptions in deep sleep, triggering small spikes in heart rate and stress hormones that the person never consciously registers, but the vascular system responds to every time. One monitoring tool worth considering is a simple clip-on device worn on the finger overnight that tracks blood oxygen saturation continuously. If oxygen levels regularly fall below 92% during sleep, that data represents a specific conversation worth having with a physician. It may indicate sleep apnea, circulation concerns, or early respiratory changes, all of which carry meaningful implications for stroke risk and brain health. Most physicians, when presented with that kind of overnight data, take it seriously in a way that a verbal description of feeling tired in the mornings rarely achieves on its own. The central point beneath all of this is straightforward. The risk to your brain and heart does not pause when you close your eyes. In many respects, the hours between midnight and early morning are among the most consequential hours in your cardiovascular day, and what your body is doing during those hours, the angle it is held at, the vessels it is compressing or releasing, the waste it is clearing or leaving behind, is something you have direct and immediate influence over starting tonight. Not with a prescription, not with a specialized program, with a position. One change is enough to begin. Shifting to the left side tonight. Elevating the head of the bed by 15 degrees. Finishing dinner 3 hours before lying down. Replacing a stack of pillows with a single contoured one. Any one of these, applied consistently, is not a minor adjustment. It is a nightly intervention that compounds across weeks and months into something your cardiovascular system will register as a meaningful and sustained improvement in the conditions under which it is asked to recover and repair.